Hello everyone. Today we are going to discuss about this recent article which is published in the journal PLOS One, and this journal is indexed in all the three major databases or indexing services like Scopus, PubMed, and Web of Science. I've verified from the original resource. So this seems to be a reliable journal, and the topic for this article is lung flare care, development of a web resource to improve recovery after COPD exacerbation. So here these researchers have developed an instrument which is a web-based instrument, and the name of that instrument is it is a patient education instrument, and the name of that web resource is lung flare care. Okay, so it has been conducted in Australia, in University of Monash, Department of Physiotherapy, Monash University, Frankston, Victoria, and Department of Physiotherapy, Monash Health, Melbourne, Victoria, Australia. Okay, so let's go through quickly through the abstract. So what they did was basically this study was conducted into three phases, and the patient education instrument was developed, and the patient population was acute exacerbation of COPD. So what they have seen as a study gap was that the care for acute exacerbation of COPD is suboptimal, which is documented in the research, and they wanted to give a high quality accessible information regarding their conditions and priorities of care is to the patient, and they have said that it is challenging during this time. So they wanted to develop a patient education resource which should be able to give the patients a high quality information regarding their condition. So the primary aim of this study was to develop and evaluate the utility and usability of new co-designed web resource. So they didn't just develop, they also tested this web resource whether it is effective or not. Okay, so the first phase was content analysis phase, where the interviews was undertaken of 8 patients, 2 caregivers, and 9 multidisciplinary healthcare professionals regarding their experience during and after the acute exacerbation of COPD. The results of this interview was then informed to the 20 international experts, and the Delphi method of survey was done. So what is Delphi method? Where you interact with the experts in an interview basis and you implement the changes or their suggestions given by the international experts or the experts in that particular field. So they have used Delphi survey method, and 20 international experts and clinicians and researchers has participated in this phase 2 Delphi survey. Okay, then the consensus items, whatever the feedback they have received from the experts during the Delphi of phase 2, which was informed, then it was informed to the web resource construction team. So there was a separate team, they were developing the website. Okay, and the consensus, the feedback was informed to those web developers in the phase 3, and they have developed that website. And after the development, the testing was done. That means the alpha testing evaluation was undertaken by the phase 1 stakeholders. So who was the phase 1 stakeholders? 8 patients, 2 caregivers, and 9 multidisciplinary healthcare professionals. So they have tested whether the information is covered or not. And then there was they have also undertaken the testing by the patients also. Okay, so the final resource was presented via webinar to the community clinicians, and final feedback was captured via online survey. So if you see, 53 out of 58 items reached consensus. So they developed 58 items in that web resource. That means the 58 items or educational content was covered, and out of that 53 items were reached the consensus during the Delphi survey. And they have said that the tablet administered education, that means the tablet mediated education, okay, was feasible. Survey was completed in 25 patients. 80% of the patient found the resource, that means the website was effective, and 72% reported and increased willingness to participate in pulmonary rehabilitation. This is the biggest problem where patients who are not willing to participate in the pulmonary rehabilitation program. So they have shown a great rate of willingness, that is 72%, and 28% indicated they gain new insights or motivation for behavioral change to improve their disease management. So this is a big change which they have reported through this research. Follow-up of the patient evaluation were limited by, so they, this is the limitation of the study or a negative point where follow-up was lost for almost 56% of the patients. Okay, the physiotherapist indicated high levels, that means the also those who are giving patient education through this resource, they have indicated high level of satisfaction with the resource and perceived improved clinical work and efficiencies. Okay, of 21 community clinicians, the median response was strongly agree that they would recommend this web resource to the patients and caregivers. Okay, so lung flare care is a new web-based educational resource that can aid delivery of high-quality educational content for the patients of acute exacerbation of COPD. And also they are recommending further research is needed, okay, for the best implementation and recommendation and impact of this novel web resource. So I will also show you the web resource which they have developed. So this is the website, okay, which they have developed. So this is lung flare care. They are covering COPD, asthma, bronchiectasis. Okay, so if you click on COPD, so these are the topics which is covered for their patients. The patient can go anytime and access these information about the any n number of things like diagnosis of COPD, what are the stages of COPD, what are the symptoms, what healthy habits patient should follow, what are the medications. Okay, so all these are there. Okay, in short about the medications, what are the different types of mist inhalers, dry powder inhalers, pressurized meter dose inhalers. Everything has been provided for the patient. Then flare ups. Okay, what the patient should do during the flare ups, early management. The most important thing is the flare up action plan they have given. COPD action plan form is available on the website. So these kind of resources are also needed. So if you're running a pulmonary rehab clinic, so you can also develop such online resource for your patient where they can go and access to the information anytime. So if you want to learn these kind of research about these kind of research or how to get into an evidence-based practice, you can join my masterclass which is coming up this Friday, that is on 30th of May. So you will learn about evidence-based practice and how to track the latest research smartly and using simple and free AI tools. Okay, balance learning with busy schedule. You can also, if you're a busy practitioner, you can also balance it with using various AI tools. You should also know what are journal level metrics so that you do not end up into a fake database or clone journal or wrong evidence. What are the platform to search evidence, and you can elevate your practice uh, by using evidence. Okay, so embrace AI and embrace research evidence-based practice. So the fees is only 700 rupees and you can register using this QR code. Thank you. See you in my masterclass. Thank you so much.